terms of sciatica, sciatica is where you have nerve irritation on this sciatic nerve. So you can see the sciatic nerve runs from L4, L5, S1, S2 and S3. So anywhere there's irritation on these nerve roots from L4, 5, S1, 2, 3 can cause sciatica. The sciatic nerve is actually the longest nerve in the body and it runs from the spine, especially low back, and it goes down the whole leg, all the way down to the leg, even to the feet. So it's especially a very important nerve because it combines both sensory and motor as well. What I mean by that is sensory means that you can have a lot of pain, or it can be even numbness, tingling, but it also affects the motor, which means that it also affects the muscles. So you can also have weakness as well. Okay, so it's especially it's a combination type of nerve. All right, now sciatica can be caused by a lot of different type of problems. The main reason why you can get sciatica is through a disc bulge. In terms of why it can bulge, it can be through a variety of reasons. It can be through a lot of sitting, for example, a lot of bending, a lot of twisting. So over time, the disc can inflame and it can start to bulge. Okay, now looking at this model here, you can see how this is a normal disc where the disc is inside. Okay, so it's not irritating the nerve. But whenever you have a disc bulge, which is a very common way of getting sciatica, what can happen is as the vertebra misaligns, it can start to irritate that nerve. Okay, so you can see it bulging and hitting that nerve. And that is when there's acute inflammation. This is where this can then cause really, really bad sciatic pain running all the way down the leg. This is one cause. Another cause of sciatica can be through the disc getting very, very thin, plus you get a lot of bone spurs. For example, this is the bone spur here. So you can start to see there's a lot of irritation on the bone here. And so as you have bone spurs here, it can mean also you have bone spurs inside, especially in the joints in here. Now, if there's a lot of spurring inside here, it can then mean that there's less disc space, which then starts to irritate the nerve as well. Whenever a patient has low back pain in conjunction with the nerve going all the way down, the further it goes down, the worse the prognosis. So we actually like to prefer a patient who has low back pain only, but if they also have a lot of nerve irritation going down, especially both in terms of weakness, so the motor section, as well as sensory, so a lot of numbness or tingling, that's not a good sign. And that's why it can actually take longer to get someone better. What we want to see is that the patient, as they get better, is that this area, for example, gets less and less problematic, and then it goes into the thigh, and then gradually goes into low back. That means that sciatic nerve is starting to heal up. The worst thing for us to see is that the low back gets better, but the leg actually gets worse and worse. That means that sciatic nerve there's a lot of irritation on that sciatic nerve and it's been prolonged, and a lot of times that can then, if we cannot help, that means you can require surgery. In terms of sciatica, it's a very common chiropractic problem, okay, that we see a lot. So I'll say at least anywhere from 50% to 80% of patients with low back pain can present with sciatica. Okay, so it's a very, very common problem that we see in the chiropractic clinic. And fortunately, a lot of times we can actually help. So there's been very few patients that have actually had to have surgery. And a lot of times it's because the adjustments is one really, really good way to actually get inflammation and swelling out of that sciatic nerve and for that nerve to heal up.